Well, I think one of the issues that we came up with tonight was the concept of network and collaboration, and also the opportunity to learn from one another in an EU context, in a context of fostered collaboration, where actually you have a framework in which member states can exchange good practice and definitely lay out good standards that could be replicated in other countries and other contexts. Because one of the conclusions that were made in country profiling was really to note that no country was performing good in all areas in a therapeutic sector. I gave the example of cancer, where some country delegates were falling off their chair when they were realizing the basically the jigsaw of the European Union. So countries were not on the same page, but also in different areas in the same disease area, for example. If you take treatment or prevention, they could really easily lag behind whilst performing good in other. Definitely, yeah. And that's really the case also in brain disorders. If we consider the prevalence of these diseases, 1 out of 3 persons will be affected throughout his or her life. So that means between 165 to 179 million people at the level of the EU. So if you consider also issues like aging, public health threats like alcohol, smoking, there are definitely opportunities by which a country can benefit from belonging to the EU. Well, an interesting example was provided with research on dementia. The UK really had that intention and objective to become a leader not only in the EU but also globally. There is definitely a threat, not because of a lack of funding, but the threat in leaving the EU would certainly be that inability to network easily with other countries and take advantage of the expertise that is really lying in all other countries from the EU, all other member states, and pulling together that expertise again to try and leverage the best outcomes in terms of clinical research.